Welcome, everyone, and thank you for attending the National Alzheimer's Project Act, NAPA, public information session hosted by the Cleveland area and East Ohio chapters of the Alzheimer's Association. My name is Steve Osgood, and I will be your moderator this evening. I am a board member of the Cleveland chapter and chairman of the chapter's Public Policy Committee. More importantly, I'm an advocate for the Alzheimer's Association, just like each one of you attending this evening. We have limited time, so I will keep my remarks brief in order to get to our mission at hand. But I have to let you know I have been advocating for this cause since 1990, and this is the most exciting news we have ever had in public policy. NAPA was passed unanimously by Congress. Let me say that again. NAPA was passed unanimously by Congress and signed into law by the President in January of this year. We were all instrumental in the passage of NAPA, but now we have the really hard work to do, which is implementing this law. Tonight is an important step as we want to hear what you would like in the National Alzheimer's Plan. You are the experts, and what we are looking to hear are the challenges that you have faced or currently face that need to be fixed by the federal government. Any topic is open for discussion. Please do not hold back. You have made the effort to be here tonight. Please make your voice heard. The only rules are as follows. Please keep your comments short as we have limited time and many areas to cover. Because we are taping this session, if you have a comment, please raise your hand and wait for someone to hand you a microphone. And while your stories are important, please connect the story to the problem that needs to be solved. I may introduce a topic if I feel that we need to move on to a different subject, and that will only be because of time constraints. At the end of the evening, or any time later, you have an additional comment that you would like to submit, please visit our website, which is up here on the sign, www.alz.org/NAPA. Finally, before we get started, I would like to recognize the federal legislative staff in attendance this evening. We have Beverly Charles from Congresswoman Marcia Fudge's office, Lori Rokakis from Congressman Dennis Kucinich's office, and Meredith Turner from the office of Senator Sherrod Brown. Now, who would like to get us started?
Hello, everyone. My name is Tangela. I'm Ms. Charles' student, an MSAS grad student, but I'm also a child of Alzheimer's. I am a younger caregiver, so I would like for the strategic plan to speak to the younger people. I was about 29, 30 when I took on the responsibility of taking care of my mother in her home. So I would like more incentives at work, tax credits as far as the IRS, more support systems to maintain a community-based living situation instead of an institutional care situation. So among other things, but I'll keep it to that, so I have a whole list of things I would like, but specifically my interest is the sandwich generation.
Good, I can get this over with. I wrote it down. I have two things, and I'll make it quick. One, the Alzheimer's caregivers in the home, in my opinion, are the #1 class of victims of Alzheimer's. It's not those suffering from Alzheimer's, it's those caregivers, especially if they're stuck in the home with them. So, whatever, well, for example, I hear surveys done where the surveys of the elderly, they just want to be home. Well, if you ask the caregiver, you might get a different kind of slant on that. So one, please do surveys of the caregivers and don't just stop at those who are elderly. And second, please, whatever you do, keep in mind that someone said it's the caregivers who are the #1 victims. Number two, having to do with research, if Alzheimer's is growing faster and it's due to something other than just the growth of the elderly population, then there's got to be some cause for it. And like for cancer, we sort of knew that cigarettes and asbestos and dumping chemicals without any kind of responsibility, in other words, carcinogens, could cause cancer before we really had a lot of cures for cancer. Well, I'd like to know, before we have a cure for Alzheimer's, maybe somebody can research, what can I avoid? What's our version of carcinogens? And so that would be just how to aim research.
Hi, excuse my voice, it's a little raspy this evening. My name is Rose M. Allen. I'm an advocate and a member of the Public Policy Committee. And I'm really glad that the gentleman brought up the question about research, because I think I'm in a situation where I could be paying forward any effort with Alzheimer's, because I do know I had a great aunt who had all the manifestations of Alzheimer's long before the name Alzheimer's was attached to the disease. But I'm also really dovetailing on the previous person's comments about research. I'm a big proponent of finding the cause of any disease so that we can work on trying to prevent a disease. There's something that must be triggering, other than just living long, there must be something that's triggering the increased numbers of people developing Alzheimer's. So I really would like to see that there is a concerted effort placed toward looking into markers of finding what may be the triggers that can bring on the early onset or normal onset of Alzheimer's. And I think that's going to be very important. Working toward a cure is great, but I think we need to come up with some answers as to why people develop Alzheimer's.
Good evening. My name is Phil. My wife was diagnosed with early onset 4 years ago, and I agree with him 100% about the caregiving, and especially in the younger cases. But there's two things I would like to say. First thing, it took us over 2 years' time to really get her diagnosed correctly. Because of her age, she didn't qualify for any of the PET scans or anything. Nothing was there. We finally paid for a genetic test out of our own pockets, and it turned out that she had the gene. She's part of a study now, which is called the Diane study. Everything, you know that, Bruce, very well, and everything. So one of the things I would like to see is a way to have the funds, or in some way, shape, or form, be able to provide these avenues to people that aren't 65. And by the way, my wife was a nurse at the clinic, okay, and that insurance would not pay for a PET scan. Okay, so one of the things there. And secondly, I understand that the plan being done in the States is going to be more or less written based upon the French plan. I could be right, I could be wrong about that. I have read the French plan, and the French plan is an outstanding plan that they have done. And I would emphasize to you all, if you have a chance to read that, please do, because it's a very well done plan.
Hi, I'm Patti Gerard, and I was diagnosed with early Alzheimer's when I was 55, and I want to talk about medications because I was too young to get Medicare. Social Security denied me. This patch I wear, not that patch, there's a patch underneath here, cost me $234 a month with my copay. But in like 40 days, I'll have no insurance whatsoever. How am I going to get that? What am I going to do? You know, I'm too young. A lot of people who are elderly and they're diagnosed with Alzheimer's are already on Medicare. And I'm not there yet. So it's very hard when you're young. I haven't had some of the tests because my insurance refused them. My long-term disability then stopped my long-term disability. It's just, am I telling you a story? No. You know, that's how it is. So the, what was the thing in Maria Shriver's report, the act that got passed that said if you have Alzheimer's, the first time that you apply for Social Security, you will get a Compassionate Allowance Act. And my daughter read that book. A lawyer for 18 months could not get me Social Security. My daughter did it in 3 weeks. Okay? So you have to be an advocate for yourself. But I want to know, where am I going to get my medication in 2 months? It's just hard. And I want people to know that. I want people that make the laws to know that 55 years old, you could be an Alzheimer's patient. You know, do you want me to be your nurse at 55 and keep working? Or do you want me to be honest and say I can't work anymore? You want me to be honest? You know, it just...
I would like to see more advocates, and I will be willing to commit to this myself, particularly in the minority communities. I'm an African American, and I just knew what to look for because I had been a social worker, and I was working in the area of elderly abuse, and I knew what to do when I saw the signs in my mother. So I used the same professionals I used at anybody else's home I went in for me, but I was blessed that I had that information. There's so many people in the community that just say, oh, they're just senile. I don't know anything about that, old timers. Or, you know, just sit them in a room, they'll be fine, you know. So I would be willing to be one of those advocates and not just say what needs to be done, but we need maybe part of the strategic plan, whether it be Latinos, Hispanics, wherever, have a representative that they can actually see in themselves saying, this is what it is, this is what we need to look for, and let's go to the next step.
I think so much of what we've been talking about has to do with awareness. We have to create more awareness so people don't have to struggle to get a diagnosis, or people know that we need to do more research to find out the cause. It's all about awareness and advertising, but you know, the government could certainly help with that.
Yeah, hello. My name is Bruce Lamb, and I'm actually an Alzheimer's researcher. So I wanted to sort of touch on some of the things I think that people were talking about, research in particular, and just sort of to bring awareness also to this audience as well. I mean, just in terms of the numbers. I mean, so right now the federal government spends about $450 million a year on Alzheimer's research, which is a lot of money. But again, if you just compare it to investments in other diseases, cancer, it's probably about $4 to $5 billion a year, as opposed to $450 million, or AIDS, it's about $2 billion a year. You know, there's an inequity in those numbers. And what's happening on the side of the researcher, I can tell you from a very personal perspective, your chance of getting a grant right now, today, as an Alzheimer's researcher is about 8%. So about, if 100 grants go in, 8 will get funded. And so what's happening is the number of labs are beginning to either shut down and I think we have a potential of losing a generation of people who are working on this. And I think that's just unacceptable. And I realize that, you know, appropriations is a whole nother matter. But I think there's some things that can be done in the meantime. And so I think one of the things, and this is just an example, right now, funding for Alzheimer's research occurs across all different disciplines of the government. So within the NIH alone, there's many different institutes. So the National Institute on Aging funds majority of the research on Alzheimer's disease, but the National Institute of Neurological Disease and Stroke also funds research on Alzheimer's disease. The National Institute of Mental Health funds Alzheimer's disease research. The Department of Defense funds Alzheimer's research. And there's no coordination between all of those right now at the present moment. And I think that that's something, again, that needs to change. I mean, if we're going to really move forward in a serious way, I think of really doing research in a really productive manner. I mean, in some of the things that people are talking about here are all things I think that need to be researched. Then I think either forming, you know, in the lines of sort of President Nixon when he sort of said cancer, we need to have a war on cancer, and formed the National Cancer Institute. So one idea would be, well, we need an institute within NIH that's directed towards Alzheimer's disease. Or another would be, well, instead of a whole institute, maybe we just need an office, you know, that will sort of coordinate all the different aspects of research within the federal government. And so I think those are things that you know, could be directly, you know, linked in terms of NAPA, sort of saying these are things that could change that I think will really help facilitate research. Obviously money would be the other thing, but again, has obviously right now probably limited abilities to get that. But I think there are things we can do to increase efficiency of what we already have.
Hi, I'm Charlie Farrell. I'm a retired vascular surgeon. My wife